So today I want to talk to you about gum disease and the progression of gum disease. It's the ADA has estimated that around half of adults have gum disease. When you're 30 years old, most people haven't really experienced the full effects of gum disease because what happens as the gums are pulling away from the tooth in a pathological way is that it takes a really, really long time, like a decade, to lose 2-3 millimeters of support. But over time, this is one of those diseases that takes a long time, and so we think it's a disease of old age, but it's something that's been accumulating for a long time for people. And what happens is sometimes when they're 60, 70, 80, 90 years old, they begin to lose teeth because the gums have had enough time now to really pull away from the tooth, and then it eventually gets loose. By the time a tooth is loose, it's pretty much too late to save it. There are a few teeth that I've been able to save in my practice, especially the lower front ones where we can kind of splint them and treat the area with a laser. But for the most part, if a tooth is already loose, it's gonna go bye-bye, unfortunately. So for my aging patients, I really recommend that we get in there and clean the tartar off of their teeth on a very regular basis, at least 2 times a year. Some of my patients come 4 times a year if they're at a high risk for getting bleeding gums and unfortunately for losing the bone that helps hold those teeth in place.